Hi everybody, this is Dr. Oji from MP Skills Made Easy Workshops, and you're listening to the Prescriber Essentials podcast, the show that helps you delve into the world of clinical skills and knowledge for clinicians who love to continually improve their clinical skills. I discuss content to help you grow professionally and the opportunities and strategies to provide excellent care like a pro. So just the concept of antibiogram, wanted to introduce that concept to you as a clinician and also, of course, as a student. You want to know that antibiogram reports, that show how susceptible the strains of pathogens are to a variety of antibiotics. So we use this in our clinical setting, the family practice setting, of course, in the hospitals as well. Be aware that antibiograms can also be used to compare susceptibility rates across institutions and also to track the level of resistance. I think that is important for you to know. Because if you think about it, here in the state of Texas, there's a high level of resistance to Bactrim. I don't know if you all are familiar with that. So you'll find that sometimes when you prescribe Bactrim in patients, the patient will come back when the sensitivity report comes back that this patient is resistant to Bactrim. So you want to know about the antibiogram and the concept, and I just wanted to be sure that you all are familiar with it. So knowing the creatinine clearance level is always a good idea for you to be able to determine the severity or the staging of a patient's chronic kidney disease. So again, just to reiterate, you know that with stage 1, this is where we want the patient to be. Greater than 90 milliliter is where you want this patient to be. With stage 2, between 60 and 89, we always assume that anyone older than 65 should be that bracket again, because with aging, we find that patients' renal function decreases, right? So again, that's the reason why you want to keep a keen eye on the patient's renal function while you're prescribing medications in older adult patients. Stage 3, between 30 and 59 GFR level, you really want to pay attention to the patient's medications and, of course, discontinue some medications that could further exacerbate the patient's renal function. Stage 4, between 15 and 29, again, this patient should be followed by a nephrologist even earlier than now. And then stage 5, less than 15 milliliter, the patient should be on dialysis. All right, so let's talk a little bit about your Cochrane Gold formula that we use to estimate the patient's creatinine clearance level. So again, the formula, so creatinine clearance in male, you want to know the patient's age, their weight, and their creatinine level. And so if you know the serum creatinine level, the patient's age, and the weight, then now you can estimate the creatinine clearance level, which is a requirement for your patients that are older. So for male, it's 140. You want to subtract the patient's age, multiply their weight in kilogram, and then divide the serum creatinine, and then multiply 72. And then, of course, for the female patients, you want to calculate out the male. So it's going to be 140, subtract the patient's age, multiply by their weight in kilogram, divide the serum creatinine level, multiply by 72, and then multiply by 0.85. The reason why you do this for female patients is because we already have a decreased BMI index. So you want to be sure that you're keeping that in mind and while you're calculating the patient's creatinine clearance level. And then, of course, we also know that the patients, older adult patients, they lose their muscle mass as they age, which could deceptively lower the creatinine level. All right, so I have a case study here for you. So this is Miss Finder. She's an 85-year-old patient with dementia. The patient has urinary incontinence, dysuria symptoms, burning and urination. Again, that's dysuria. This has been going on for 4 days. Patient is here in the clinic with her daughter. She weighs 72 kilograms and the creatinine level is 2.1. So the reason why this is important is for you to be able to go back here and plug in those numbers here to be able to get an estimated creatinine clearance level. So I really want for you to pause at this stage and go back and calculate out the patient's creatinine clearance level, because that will tell you what to do and where this patient is in terms of creatinine clearance and when you're prescribing some medications for them. So the daughter states that her behavior is worsening. Patient can't be left alone anymore. She has been urinating on chairs and slightly more confused than before and wandering at night. So again, this patient, the current medication would be Aricept. So the patient is on Aricept for their dementia. And then the patient has allergies to penicillin, Bactrim, and these are the two main allergies that the patient has. So the question that you want to ponder would be, what would the APRN do? Okay. Do you want to refer this patient out to the emergency room for delirium? Do you want to decrease noise and activity around patient? Do you want to start Haldol and monitor for delirium? Or do you suspect a UTI and start treatment? So let's go back to this case study again. So this patient here has symptoms of dysuria and burning on urination and urinary incontinence that has been ongoing for 4 days. And the patient's daughter says that their behavior is worsening. So you definitely want to keep that in mind and suspect UTI and start treatment. All right, so let's take a look here at I have an antibiogram for the UTMB. So again, let's take a look at the gram-negative bacilli. So E. coli is the most common microorganism that we find in patients with urinary tract infection. So you can see the number of isolates right here. So that's more than 5,000. And so if you scroll down, you can see, again, 54%. This is all numbered in percentage. So 54% with ampicillin is not a very good number. You want it higher than that. You want it actually closer to 100% to tell you that the patient would do really well with the medication that you're wanting to prescribe. So again, ampicillin at 54%, you can see that we're not going to use that. And then if you scroll down, you'll find that most of these medications right here, 8362 means that you have a 48% chance that ampicillin sulbactam would work. So we don't want to use that. So 96% here, that is a very good number, piperacillin tazobactam. The only thing about this is that we're in outpatient setting, so we do not want to use it. 89% with the cephalosporin, 75 here. You have the ceftazidime right here at 93%. Again, most of the cephalosporins you see here are either IV or IM. So again, we want to make sure that we're starting with an oral before thinking about an IV antibiotic. So aminoglycosides, they're nephrotoxic, even though they have a very, you can see the very good rates right here. Most of them are nephrotoxic, and then most of them are also IM or IV. And so we want to just keep going. The carbapenems are also in the same category. Most of them are IV. So here you can see that the penicillin, the fluoroquinolone, so ciprofloxacin and levofloxacin is at 82%. So it's something for us to kind of keep in mind with this patient. So again, we'll keep moving to the miscellaneous. So you can see the minocycline is 85, which is not good. Your nitrofurantoin would be, that's your macrobid at 97%. That is really good for this patient. But again, you have to consider the patient's renal function. Okay. You do not want to use this on a patient that has a renal function less than the creatinine clearance level less than 30. So again, this is something for you to consider, and this might not be a good alternative for the patient. So we keep moving here, and we can see Bactrim. Bactrim is 72%. So that means that there's a 28% chance that this would not work. And so we have to consider the patients. Let's take a look here and see the patients. Hopefully we can see it. So a patient has allergies to penicillin and Bactrim. So Bactrim is out just because of the patient's allergies. We cannot use it. Okay, so the only options we have here based on this antibiogram would be, let's see here, would be macrobid, but we said we're not going to use it because of a patient's renal function. But we have the fluoroquinolone. So 82%, again, 18% failure rates would be a good place to start. So we can start with ciprofloxacin, again, based on the patient's creatinine clearance level. We know that this patient is in renal failure already, and we do not want to use a maximum dose of 500 milligram. So we can start this patient on ciprofloxacin 250 milligram. We can do that twice a day. and then have this patient take the medication for 3 days. And then again, you want to be able to see if this is effective for the patient or not. Okay. And so let's continue with the case study. So the daughter calls you a few days later. So states that the symptoms are worsening, even with this patient on ciprofloxacin, which we started this patient on. And now the patient is having a hard time recognizing her. And so what would the APRN do? So the things you want to consider with the questions that I have here, is this a complicated or a simple UTI? In this case, this is becoming complicated. We started with a simple UTI, but you can see that we have antibiotic outpatient failure here because this patient is on ciprofloxacin, but still we find that the patient's symptoms are not resolving. So does this patient need IV antibiotics? At this point, we would consider having this patient going to get some IV antibiotics in the hospital. Okay. And then, of course, you also want to think about the fact that this patient may have gone into delirium. So not just the UTI now, but if the patient is having a hard time recognizing the mom, the patient could be in a delirious state. Okay. And of course, with the worsening symptoms. If that's the case, then the patient would definitely need a sitter. So the question about would this patient need a sitter? Yes, the patient would need a sitter. So if the daughter can stay in the hospital with her mom while she's getting the IV antibiotics, just to be sure that she doesn't fall, that would be really helpful. Okay, so this is the end of the presentation. I just wanted to do this quick video so that you're familiar with the concept of antibiogram. You know how to hopefully take a look at it and make sense out of it, really interpret the results and use that for your patients, for your patient care, and to improve your patient outcome. All right, thank you so much for listening, and I hope you have a wonderful rest of the day. Bye now.
If you like what you hear on this show, then be sure to check out our Prescriber Essentials Academy, which is a continuing education platform where we delve deeper. Visit schools.mpskillsmadeeasy.com to join us. See you on the other side.